It is now my privilege to invite respected administrator with extensive experience in public systems and healthcare governance. May I request Dr. C.S. Kedar, IAS retired, former Director General, ESIC, Senior Advisor, IIHMR Bangalore, to please come forward to the stage and address the gathering with his valuable perspectives.
Have anything valuable to share. In fact, I am the only odd man out there. Odd man out for three reasons. I am Dr. C.S. Kedar. I am not MBBS doctor. I am a PhD in political science. So I am the first odd man out there. Of course, political science, the first thing that I would love to, whatever I learned from Jain Saab, DQ, decency quotient. I think it's highly needed for all public executives. All public executives now should be trained on that. I think we should have new training modules which should come, because that's one of the important things, because gradually we must learn that people with extraordinary brilliance are going to really run the country and the globe. So we should learn to be more humble than necessary. I'm also odd man out for one more reason. When Rubel, her name is Rubel, na? Rubel asked percentage of success, somebody said 60, 70, 80. I was the only odd man out who said 100%. You must be wondering, it was by instinct I said 100%. Because in public service, if you don't do anything, no problem. But if you do 100 things, out of that one fail, then you are crucified forever in the whole service. One cannot go wrong, right? Even if you don't do 99, no problem. So you can't just say that I'll have one. That's why I told 100%. So I'll tell you simple things that has happened in my life itself. When I was DC in Bijapur, we were doing in a big way this polio drops. We had not overcome polio. So one baby died. I don't know why it died. As the deputy commissioner, but I'm not even a doctor, but one baby died. The whole polio vaccine for that year was gone in the whole district, in the surroundings at least, most of the district. So one failure is something that can trigger lots of changes in India. So, in fact, when I was Ballari Deputy Commissioner, I had become a little more better, but even then, we had diarrhea in a village thanks to contaminated water. We gave ORS, what you call ORS. We gave ORS, one child died. We don't know why. He had not found out any medicine, how to overcome that. He had not given me any medicine to, when one person died out of drops, polio drops, how to handle that. We didn't know, we had no medicine. So, next 2-3 days, I had to admit 50 children, giving them drips, because I couldn't give them ORS. So, one of the things that we always, in public service, we are worried is, we are not happy with 99, we want 100%. So now with one small thing I am going to end. As I told you, I can only give lecture on political science. One of the things as DG ESI I have noticed is that 70 to 80% of the people who come to my hospitals, minimum 70%, they come for only similar ailments. Hospitals are full because of similar ailments. This is true of all government hospitals. Private, they will think because they have to pay a little more, so they think. But since in government or ESI it is free, they come. And possibly we have to come out with systems which prevent people from coming to the hospital. Now, when I was about, this is from my past history, but if you come to future, all lifestyle diseases are all going to make hospitals full with patients. So a stage may come where probably pharmacy, for world it may do something else, but for us, they have to find out either a vaccine or inoculation or some sort of a drug which can protect for 6 months, 8 months. It could be as simple as diarrhea, as simple as influenza, as simple as cold. So if we want mass cover and we have such dispersed population, possibly the invention should be prevention and ensure that people don't come to hospital. And we ensure that, as he says, anybody else in the world, he props up a medicine, he thinks of India, but for India, we will not give that drug. We'll give something else so that it's more into preventive. I hope the drug industry here is able to do it. Maybe some drugs we can still sell in India. We have no issues because there are some urban areas where they are willing to purchase. But if you look at majority of 70 to 80%, probably we must look at preventive. 1 year you take. Of course, they have come out with for influenza, there something vaccination, but we have not fully succeeded. So rural area also, young people having recent survey of high school students, Professor Shadgopan, it might worry you. High school students having problems of diabetes, having problem of blood pressure, having problems stress related. So possibly I think a time has come where we are, and rural areas, it's not urban areas. We all thought some of the diseases were only rich people. So I was having a problem of, as a DG, I was having all my stress related problems. But I was surprised to know my driver was also taking the same medicine. He also had same disease. So I think now it is becoming neutral. So I wish all of you all the very best, but keep it in mind that all the diseases are now status neutral. So we should have different types of drugging. I'm sorry, drugging is not the right word. Okay, medication for different people. So thank you. I think you can do that under Jain's leadership. Thank you very much. I wish all the very best. I want a lot of our students now. IIHMR is full. I think Professor Shadgopan should be the happiest man. We were only having health management. Once he came, hospital management. Once he came, we stepped on to health management, which was little more tech oriented. Hospital was mundane things. Then we started AI and data. And now pharmacy with tech orientation. So now we have completed the whole globe. I don't know, some other piece may be there, maybe 4 or 5 years down the line. I am grateful to you, Professor. Thanks for always being associated. And he has justified that our campus is in Electronic City. We are the closest to the Electronic City, and our 2 offices were hardly 1.5 kilometers. We never met. So fortunately, I knew IIIT, right, when I was finance secretary. I knew IIHMR from 2009. So it so happened that one day I said, you come. And then things started changing. Thank you, Professor, again. Thank you, Usha, for encouraging all my idiosyncrasies. Thank you very much.